concerned me is when I opened him up, the size of the tumors that was inside of him. He had mets all over his body. The tumor, the big tumor, was this big, and nobody said anything to me about it. Nobody said that when they did a physical or palpated the ferret, that they felt anything unusual. Okay? That ferret was nothing but skin and bones. You guys need to be able to start paying attention to, is it abnormal? Okay? There's no way he just became abnormal in the last couple of weeks, or the last week or so. So we really have to start paying attention, okay? You're not just jumping through a hoop. That's what a lot of people seem to think when you're here to do husbandry stuff. Is you're just jumping through a hoop because somebody has to do it. No, it's to give you guys a chance to see behavior, to see actions, to see all that stuff. And if something looks out of normal, you got to tell somebody, okay? I couldn't believe, I've got pictures of how bad the tumors were. His spleen was just completely engulfed in tumors. The big tumor that was either a adrenal tumor, or it could have been an insulinoma, it could have been lymphoma. I don't know which one it was. But literally, it was this long and that wide. So when you touched him right there, you could feel it. And it was really hard, okay? That should have been easily picked up, okay? Especially when it got that big. Did you get the pictures of it?
Yeah.
Yeah, you could send that to, well, don't send it to anybody but this class. You cannot share it with anybody. But if you want to see it, you can either send Jessica's phone around so you can see what we're talking about. All right, so let's start talking about ferrets. The first thing is ferrets are not used much in research, okay? I was just over at UNLV just a little while ago, and I went through their lab animal stuff. Ferrets were not even there. There wasn't one ferret that they used for research. They used to be, and in certain cases they still can be, but it's just not common anymore. But it's a good pet, okay? As long as you live in certain states. There are certain states where they're illegal to have. One of the things that we've seen is that these ferrets, because of the lack of understanding by people that make rules, they say that they have to all be spayed or castrated and then descended before they ever hit the market. That's one of the reasons why we're seeing tumors happen in these ferrets so commonly now. Because they're spayed and neutered so young that they don't get any hormone influence. None of that happens anymore. Now, the other thing is the reason that they've been ostracized in places like California, besides this, I almost said stupid, but I could say stupid. The stupid people that run California, okay? And they really are stupid. They don't understand things, and they don't know that they don't understand. And when you don't know, you don't know, you become very dangerous, okay? They think that they bite all the time. Well, they don't. Now, could they? Yeah, but so many dogs, so many cats, okay? Especially if there's something around they don't understand. Now, there is one species of ferret that is indigenous to the United States, Canada, that's the black-footed ferret. The last I heard, it's on the endangered species list. There's not that many of them around, so they are protected. When we look at the domestic ferrets, we have either the Fitch ferret or the albino. The Fitch ferret are the ones we have back there. Varying shades, but they have the mask across the face, and their eyes are usually dark. Albino ferrets are white, and their eyes are pink. And pretty easy to tell the difference between them. Male ferrets are the Hobbs. The female is a Jill, unless she has been spayed. If she's been spayed, then that's a Sprite. The offspring of ferrets are kits. Okay? Now, when you look at the domestic ferrets, again, pets, most, very few are used in research anymore. When we look at the variety of them, these Fitch ferrets and albinos, obviously those are not domestic or not domestic, natural to the United States. They come from someplace else, and generally that's from Europe. Okay? They have kind of a funny name, Mustela putrefactorius, which means they stink, basically. And they stink even if they've been descended. These guys back here, you can smell them. Just touching them, you can smell them. Imagine what that would be like if they weren't descended. Now, I used to descent ferrets all the time. It was one of the worst things in the world to be descending a ferret and have one of the scent glands open up during the surgery, because then it just drove you out of the room. That's how bad it could get. Okay. Black-footed ferret, that's the one that's indigenous in the south. Up in Wyoming area, can go up as high as even into Canada. Now, if you look at that Fitch ferret that's there, that color is called a sable, okay? And it's got the band, the mask around its face, it's got dark hairs, and it's got light hair. There is not a mixture. When you have a mixture or a roan, you guys know what a roan horse is, right? Okay. That doesn't really happen in ferrets, okay? They're separate, the dark hairs and the white hairs. Let's see, sable again, I see a few others. Now, that sable color, or the Fitch ferret, can have different types of colors, like sable. They can also see the cinnamon, they can see silver, panda types, but all of them have that same kind of an appearance, okay? Different colors with the mask. Again, albinos won't have that. Here we talk about that. Different combination of colors, okay. All right, albino, again, that's the easiest way to look. Look for the eyes. If there's no pigment in the eyes, especially in the iris, that's going to be an albino. The white coat can start to become yellow as they get a little older. It has a little bit to do with their scent glands, if they still have them, and if they don't, they still get yellow. But that's because of age, the environment they're in, what they're sleeping on, what they eat, if they urinate on themselves. Lots of different things will help contribute to that yellow discoloration of the hair. Cinnamon, again, that's, if you look at it, it's got the Fitch characteristics, the band across the eyes, but now it's just a little bit lighter color than the sables. And then pandas, but you can see all of them. They've got the band, they've got the mask around the eyes, okay? Anatomy, they're very similar to cats, okay? But they bend a lot more than cats do. You can bend a ferret in half, and it really doesn't bother it too much. But the anatomy is still essentially the same. They can get into really tiny places easily. When we used to have our program up on the second floor, we had a ferret, and it got loose in the classroom once. And it climbed into this little hole behind the cabinets, the shelves. And we had to find the smallest student we could find to send her in after the ferret. Okay? So they can really hide, and they do that as a play or something. They just want to go exploring. Males are bigger, we know that. The smell that you guys are getting is not from scent glands because they've been descended. So that's the smell that you're going to get. It's usually from the oils that are in the hair or in the skin already. Okay? Let's see, what else does he cover? The surgical removal of the scent glands. They're like a skunk. Or if you've ever seen a cat or a dog's anal sacs, they're in the same locations. Okay? So it's basically the same thing. Descenting a ferret and taking the anal sacs out of a cat or a dog is essentially the same surgery, but the size is a lot different. Everything pretty much is still the same. They have to be descended before they're sent out from the pet stores nowadays. And it's really pretty easy for a ferret to get hyperthermic, okay? And that's because of their skin. It's kind of like a dog or a cat. They don't have sweat glands all over the skin, okay, like you do or like a horse has. So you have to really watch temperature levels. Respiratory loss of heat, that's the same as a dog. They have the 5 kinds of salivary glands as well. The mandibular glands, the ones that everybody feels in their cat or a dog, they're right here. Those aren't lymph nodes. And they're not on lymph nodes on a cat or a dog either. They feel big, okay, but those are salivary glands, specifically the mandibulars. Vertebral formula, anybody see a difference between that and a cat?
Yes, thoracic.
Huh?
The thoracic vertebrae.
Okay.
The water pump.
Yep. How many more?
2.
2 more, because there's 13 in a cat or a dog. Okay? Not as much as a horse. A horse has more than that. So one of the things you got to understand is that based on species, the vertebral formula is going to change. Lumbar vertebra, they say 5, but the ones I've seen mostly are 6. But that's pretty typical. 1 short of what a cat or a dog would be, because they have 7. Okay? But notice the cervical vertebra. All of them have 7. All mammals have 7 cervical vertebrae. Small sternum, thoracic inlet, you guys have seen how narrow they are. There's not much there, but the sternum, if you see the picture of Loki, the necropsy shot, you can see where I had to cut through the sternum to get to that. Pretty much the whole sternum, but because they're elongated, the sternum looks smaller, but it still covers the same number of ribs. Okay? Claws are like a dog. Their os penis is not like a dog. It's J-shaped. It's really kind of an unusual thing. Well, what's interesting is most people don't even realize they have an os penis because their penis and prepuce are so tightly adhered or close to the body. So next time you go in and palpate baby ferrets, palpate very gently. You should be able to feel the bone in it. Okay? Cecum and appendix or cecum. Why wouldn't they have a cecum? Huh? Because they're true carnivores. Only the animals that eat a lot of plant material are going to have a big cecum. Okay? 30 deciduous teeth, 34 permanent teeth, 50 to 75. That's pretty much the same. Does this look familiar to anybody? What's it close to? Cats. Very close to cats. Okay? Simple stomach, because they are not fermenters. They're carnivores, they're true carnivores. They have to eat meat. Okay? You cannot get by, just like a cat, by trying to feed them a vegetarian diet. It doesn't work. Okay? All right. All the physiologic data, pretty much what you would expect. 5 to 8 years. I've seen some of them last a lot longer than that. Okay? They reach puberty or start having cycles, especially how many cycles do you think they have a year? 1, because they're in the same kind of family as baby. Right? Blood volume is pretty much typical. What's the blood volume for a dog? It's about 7% of the body weight. So it's about the same here. But obviously they're a lot smaller, so the total volume, that's not something that I would worry about remembering that much, but knowing it's about 7% of their total body weight, that's what I would remember. Heart and lungs, long trachea, large airways, and breaking down little places that get high. The trachea is really long because they are elongated. That's not the only difference. 2 left lobes and 4 right lobes. Is that the same as cats? pretty much is, except for on the left, one of those can be divided into three. You can do the same thing in ferrets. It's almost got a division. Maybe that radiograph or that acropsy picture shows, I don't know. I wasn't taking the shot for that. And then the yellow nodules. I don't know if they've ever found out if those things are fat. I'm not sure. Go ahead.
I just have a question about the blood volume. I'm pretty sure we went over it before in one of our classes, but if that's the total blood volume, what's the safe amount to take? Like if we had to withdraw blood?
How much can you take?
Yeah.
Only what you need.
So if I had 70 mils of blood, it's safe to take 10 mils?
No.
So
How
how would I
much
figure
is
that
it?
out?
You take what you need. You don't go more than that.
But is there like a math rule?
No.
No?
If they lose blood, that's a different story as far as taking. See, when you said the word take, that means it's iatrogenic. We're doing the problem. We can't take more than we need.
If I had to run diagnostics on it and I needed a certain amount of blood?
You don't. You only take what you need. Does that make sense?
That doesn't.
Because the amount of blood that you need from a ferret is going to be less, but that means you have to use a different kind of laboratory system for smaller animals. We don't take blood to a certain volume. We take blood only with what we need. Okay? All right. Gender is pretty easy to tell, obviously. The penis of the male is a lot more cranial. It ends up on the average. And that's pretty much the same for any animal, any mammal. The distance between the anus and the genital opening is further apart in the male. And in the female, it's closer together. Right? Well, that's kind of hard to tell unless you've got another one to compare it to. But if you look at it, if it's on the ferret, the end of the penis or prepuce is going to be on the ventral abdomen. It's not like a tomcat where it's clear back in the perineum. But even in a cat, the distance between the anus and the genital opening is different. Same thing with mice, same thing with rats. Okay? Astrocytes, they basically have the same kind of a thing. They have cycles, just like the dog, just like the cat, just like all the other mammals. During that time period, the vulva is going to swell up, they're going to elicit pheromones, and that's going to then bring the males in, or let the males know. One thing you have to always do, though, if you're purposely breeding them, is when you put them together, you've got to watch and make sure they don't fight. However, are you guys ever going to see that? No. Why aren't you going to see it? They're spayed or neutered before you guys ever even get them. Okay? So the chances of you having to see all that stuff is pretty rough common. Now, if you're in a breeding facility or they're breeding them for sale to pet stores or whatever, you might. But that's pretty uncommon. Okay? So all of the stuff about the cycle itself, the estrus cycle, it's kind of a gee whiz thing for you guys because you'll never see it. They do ovulate about 34 hours after copulation. Okay? Do other animals do that? It's not quite that long in a cat. It could be pretty quick in a cat, but they are seasonally polyestrous and they will ovulate after the breeding cycle. The gestation is a little shorter than a dog and a cat, about 40 days. And males are pretty stupid, okay? They don't really understand what they're supposed to be doing, so they just want to get it done. Okay? You should say stimulation. It's just like human females. When you get a group of human females and they're constantly together, one thing that is extraordinarily interesting to me is all of a sudden the cycles start getting really timed, very similar. You guys notice that? That's weird. But that's what happens with them too. Now, you could stimulate, you could change things by putting some GnRH in them. That could change things. Okay, let's see. Pseudo-pregnancy may occur. Why would pseudo-pregnancy occur? Or what keeps them potentially pseudo-pregnant? The corpus luteum. It sticks around. Okay? Let's see, what else? 2 litters a year. Again, that means they're seasonally polyestrous, just like cats. Okay? You guys know how friendly they can be. That biting thing, to me, that doesn't happen nearly as much as the stupid people in California think it does. Okay? I think there's another reason that they would have bitten something. Right? That you have people that just don't know how to react because they don't know anything. Females will become maternally aggressive if they think the kids are being threatened. But you guys, again, are not going to see that because they are spayed and stuff. Let's see. They can get anywhere. I can see one up here top behind the cabinets. I can't see anything there. You guys don't already know. Have you guys heard them scream? And they will, especially if you're doing something, trying to restrain them. You may see that or hear that. Again, make sure you don't put anything in with the ferret that they might eat or swallow, because they will. They'll put things into their mouth. It's just like a little kid. Everything goes into their mouth. And they'll swallow it, and then you end up with a GI foreign body. Be real careful with that. Swimming, I've never seen a ferret swim, but I don't want you guys filling the tub up. The ferret, just to see what happens, okay? Because I don't know, I've never watched them do that.
Mine swim.
Huh?
Mine swim.
Where?
In my tub. Up there when I was in the bath and jumped in and were sleeping.
Okay.
They actually, like, I
Oh, I'm sure they do.
I didn't put them in there, but they jumped in and were sleeping.
Oh, they must like it then. Okay, and if they get their head in, they can all of them. You guys see them during play, right? Watch them. They'll start to hiss or they'll start to bounce around all over the place. And then they are predators. These things will attack. If you put a mouse in there, he won't last long. I guarantee you. They're predators and they'll go after things like that. Their sense of smell is pretty good. You know that. And you guys have seen how much they sleep. More often than not, when you guys go back to clean them, they're sleeping. And they're only up walking around or doing anything when you go and disturb them. Or if you want them to play, you got to take them out of the cage. Because they really won't play in the cage anymore. When they're in that cage, they seem like it's time to sleep. So they just go in there and sleep until you bother them, like with food or whatever. This is where they think it's a problem, because they think that they bite because a baby cries. Well, to me, that the problem there is an inattentive owner. Okay? If the owner is doing their job, or the parent is doing their job, that wouldn't be a concern. Okay, you guys know about husband. Again, don't let these guys loose. Okay? I've seen you guys put the rats on the floor, at least they're in the wall, or a rabbit on the floor and just let them run around. Okay? You saw what happened when they put the chinchillas on the floor and let them run around. Did you guys not see that? We were lucky they weren't all killed, because they were chewing through the electric wires on the ground. And they actually had one of them where both positive and negative wires were exposed. But we didn't lose them. Ferrets can do the same thing. They can start chewing on things because they're really drawn to toys, drawn to things that can pique their interest, as it were. Okay, what else? Openings, again, they can get anywhere, so be careful with openings. Now, This thing about escaped ferrets might establish feral colonies. If they're all spayed, well, how can that happen? So that kind of shoots down that stupid people from California thing, okay? Because they can't. They're all spayed, they're all castrated. They can't form a feral colony. So that's pretty much an old wives' tale at this point. Years ago, theoretically, that could have been possible before they passed laws that they had to be spayed or castrated. Small feet, so be careful with the bottoms. We talked about nest boxes or soft house. When you see that, they just bury themselves in the little pockets or whatever you got back there. We talked about their temperature already. They don't have sweat glands, so they could get heat stroke, especially if their temperature starts rising above what would be considered acceptable for mammals. Okay, you guys already know that because we have that in husband. Same thing with air changes and humidity. We have a little bit of a problem with humidity here because it's just not that humid, except for recently. It's a lot of humidity in the air right now. Reproduction, don't have to worry about that. And then, have you noticed where they defecate? That's why we like to put the litter boxes in one spot where they defecate and then leave it there. Because they'll go to that spot all the time. Okay? Ferret chow. Got a lot of protein because they are meat eaters, a lot of fats. We already talked about the obligate carnivore state. And everything there you already know. I can't see anything there that you guys don't already know. Okay? Don't give them chocolate. Okay, now as far as handling and stuff, one of the things you got to make sure of is that they are used to being handled. Well, most of the ferrets that we deal with just love being picked up. They'll start trying to move around and do some exploring while you're holding them, but they just like that, okay? One thing you can do to help restrain them is pick them up by their scruff, okay? And a lot of times when you pick them up by the scruff, all of a sudden they just act like they're hypnotized. They just sit there. Unless you do something to them. And then if you do something to them, then they'll start to react. But if you pick them up and are very careful, they'll just hang there. Burrito style. This is tough. For me anyway. You can do it, but because they're so thin, it's hard to keep them in the burrito because they get out really easy. Okay? So usually when I've done that, I cover their heads up. Okay? If I need to pull blood, I usually put them under gas anesthesia because hitting the ferret veins, the jugular, that's their biggest veins. They got tough skin. Getting through that skin can be a little tough. So it's a lot easier sometimes to just have them under a short-term gas anesthetic, get your blood sample and wake them up. And again, if you do the hang thing, very simple things you can do while they're hanging there. Cage cards, you know about that, but we can also microchip them. You can put tattoos. In fact, if you've ever looked at the ferrets, there should be 2 little spots in their ears, right? You notice that? That's the tattoo that says that they've been castrated or spayed. Retroorbital sinus. I hope Dr. Goldthorpe told you that nobody does that anymore, where you stick something inside like a capillary tube, because you don't do that in mice or rats anymore either, right? He talked to you about that? Okay. Anterior vena cava, jugular vein, those are the best. Anterior vena cava, where's that though? Anterior is also the cranial vena cava. Where's the cranial vena cava? In the thorax. It doesn't become the vena cava until the jugular veins come together. And that's inside the chest. So that means if you're going to try to get blood from the cranial vena cava, you got to stick a needle into the chest. Anybody see a potential problem with that? There's lungs in there too. Okay? So you've got to be really, really good and experienced in doing that. That's why most people go for the jugular vein. You can get it from smaller, get blood samples of a small amount from the cephalic vein or the saphenous veins, but they're tiny, okay? And obviously they have to hold still. And look at how much blood they can get, okay? Kind of going back to a question earlier. All you need is maybe 2 mils, okay? So 2 mils in a ferret that has 70% volume. If the ferret weighs 800 grams, how much blood does he have? It's just math. 7% of 800 grams is how much? How much?
56.
56 mils. So 2 mils, that's not much, okay? All right, restraint, kind of similar. Again, if you're really careful, you can do it with the hanging thing. You could try the burrito, but again, I've never had much success with that. And again, only experience if you're going to go anywhere else for blood samples. Okay, here's a picture showing how to get it. And that picture on the bottom with them laying on their back, that's usually the easiest position to get blood from the ferret in. Intramuscular injection, same thing as in a cat, but what's the difference? If you're going to inject this into the hamstring of a cat, or excuse me, a ferret, what's the difference? You're thinking too hard. Short legs, little short legs, so the hamstring's really tiny. The quadriceps are really small. That's why it's a difficult thing, a lot more difficult than a cat or a dog, even though it's the same thing. Sometimes if they are really well muscled, you can put it in the lumbar vertebra or the lumbar epaxials, just like you do a cat or a dog. But the volume you can put in is a lot different because their muscles are so much smaller. IV injections, we talked about. Oral medications. Ferrets love something that tastes good, and they'll just eat it. If you can put an oral medication in there that they like, they'll just eat it. If you ever seen a ferret getting amoxicillin, the pink stuff, man, they think that's the best thing in the world. They'll just lick it up, okay? Let's see, cough reflex. And it's not much of one, so we don't have to worry too much about that unless you're tubing something. And then if you're going to go orally or put a tube in, the mouth speculum in an awake ferret is not really much of an option. You could hold them, but there's a good chance that they're going to go nuts. And you're going to hurt them because you're going to start squeezing harder and harder as they start to struggle. So you have to be very, very careful with that. Intraperitoneal injections can be done, but just like with any other animal, the amount you can give and what you give intraperitoneal is different, okay? You can't give anything irritating into the peritoneum. Even if it's not irritating, there's a chance you're going to cause peritonitis, which is very painful and potentially infections, especially if you don't do it aseptic. Let's see. For anesthesia, pretty much just like with cats, we use the same thing, isoflurane, sevoflurane. Chamber induction is nice, but you can do ferret masking down. If you hang them there, you put a little mask over their face, okay? Or put them in the burrito and put their face in the little cuff or the cone, okay? Because their tracheas are so small, being able to put a tracheal tube into these guys is kind of hard. Most of the time they use either Cole's tubes, which is one that doesn't have a cuff, but it has a tapered end on it. Or they use very, very small non-cuffed ones. Well, if it's a non-cuffed or it doesn't have the balloon on the end of it, it means you really can't control the airway very well. So you have to be really cautious with what you're doing. They're not big enough to push the air or push the gas around a rebreathing circuit. They just don't have the ability or the tidal volume in their lungs to push that air, okay? That's why we have to use non-rebreathing systems for ferrets. That means the gas comes right out of the vaporizer, goes to the animal, then whatever the animal exhales is pushed out by the flow of the gas through the non-rebreathing system. Injectable agents, my guess is that xylazine is becoming less and less acceptable or popular simply because it's harder to find nowadays. They've got the better drugs out there like dexdomitor or some of the other alpha-2 agonists that don't have the same kind of effects that xylazine used to have. But there are good combinations, just like there was in cats. In fact, I like the same kind of combinations for ferrets as I do for cats. They need to be fasted again, especially if they're adults. This is really not a big concern. In fact, most of the time they don't even use these drugs in cats and dogs anymore. If the person that's doing anesthesia recognizes that they're really not necessary. The only time I would use atropine or glycopyrrolate, which are anticholinergic drugs, to help decrease the parasympathetic input to the heart. You guys know about parasympathetic input, right? We talked about that. If I block that input, then what that does is it blocks the heart from slowing down. So that means it kind of speeds it back up. So that's the only time I would potentially use it. I would not ever use it just to decrease salivary secretions anymore. Okay? I can deal with salivary secretions. The heart rate slowing down or getting arrhythmic, that's a problem. Ketamine, xylazine, again, that's not my favorite combination. Works great in horses though, but in ferrets, the possible problem is you've got one drug that causes a stimulation of the cardiovascular center or cardiovascular system, and that's ketamine. Ketamine is not a depressant anesthetic drug, it's a stimulant. But then xylazine is an alpha-2 agonist. It blocks the release of norepinephrine from terminal nerve endings in the sympathetic system, so they get really quiet and depressed, okay? So you got one drug doing one thing, one drug doing the other, and that's why you can have problems. Barbiturates, nobody uses barbiturates anymore because their margin of safety is really, really narrow. You may see them. I promise you've all seen barbiturates used though. Every time they euthanize an animal, that's what they euthanize them with, is a barbiturate, okay? Neutered, not anymore, they're all done in 3 to 4 weeks, okay? When I used to do it, I would wait until they were pretty close to sexual maturity age. And we didn't have near the problems with adrenal tumors or insulinomas or any other kind of tumors in ferrets prior to them starting to neuter them so young. Same kind of procedures as in cats. And then hysterectomy, it's the same procedure. They have the same kind of uterus as far as its anatomy. So spaying a ferret is really similar to spaying a cat, except for they're just really narrow. You don't have to go searching very far. Butorphanol works good. Buprenorphine, it works okay, but both of those drugs, butorphanol and buprenorphine, are relatively poor analgesics. And the reason is because they're not pure opioid receptor agonists. Buprenorphine is a different drug. Mild pain is about all I would ever use that for. But the thing about buprenorphine is once it's given, it binds to the receptors in the body so tightly that you can't get rid of it. It has to go away by itself. Even if I used a reversal drug, I can't get rid of buprenorphine. Okay, it just has to stay there. Butorphanol is okay, again, for pretty mild stuff. Okay, some diseases of ferrets. One of the first things hopefully he's going to talk about is canine distemper. Canine distemper ferrets are very susceptible to that. And that's why they should be vaccinated for canine distemper. They're also susceptible to human flu. So if you have flu, don't go mess with the ferrets, because I'm not sure they have been vaccinated for flu. We don't do it. We vaccinate for distemper, but not for the flu virus. They can get Bordetella and stuff, but again, that's mostly in a research facility. If it's a canine distemper infected ferrets, they really, really have problems. Much more so than dogs. Dogs have big problems with canine distemper because it's an epithelial-tropic virus. That means it attaches to epithelial cells anywhere in the body. Now, ferrets have that same kind of problem, but usually their results are a lot more serious. They usually die, okay? And we shouldn't be using modified live. We should be using killed live vaccines. He says not to use it, but it's really hard to find that. I don't like using modified live in ferrets because they're so susceptible. And then transmission for canine distemper is usually pretty much the same as dogs and cats, okay? Are we still talking about distemper? Looks like it, yep. Now, this thing there, it talks about bronchopneumonia and foot pads and anal prolapses and all this stuff. Is epithelial tissue? In the lungs. The lining of the inside of the lungs is epithelium, right? So that means they are going to be affected with an epithelial-tropic virus. Foot pads, epithelium. Anal prolapses, because of diarrhea. Well, what's on the inside of the anus or the rectum? Epithelial cells. Anytime there's epithelial cells with ferrets, they can be affected by that specific virus. Tremors and seizures, just like you can see in dogs. If a dog recovers from canine distemper, there's a good chance that they're going to have hard pad disease. That means their pads are really abnormal. And they might have a twitch in their face. Because what is brain tissue? Where does it come from? Epithelial tissue. There's epithelial tissue up inside the brain, right? Inside the ventricles. That's a hollow area, okay? And then the fits. Okay, we talked about seizures. And that's why once they get to that point, they usually put them down. And again, if you are working in a place where distemper is possible, do not go work there and then come here and handle the ferrets. Okay? We just don't want that kind of a problem. Rabies, obviously it's a mammal. It can be affected with rabies, so they need to be vaccinated for rabies. They can have similar signs. They can be furious rabies, or they can have the dumb rabies, where they just act really friendly, they just kind of lay there. They can still have the rabies virus. So they should be vaccinated for rabies as well. I'm not sure what the law is in Nevada is if a ferret bites an animal, a human, but a lot of places say they just have to be euthanized and the head sent into a lab to find out. Well, this is Las Vegas. The chances of getting an animal exposed to rabies around here is extraordinarily low. So hopefully that's not what the law is here in Nevada. And then again, you gotta get brain tissue. Human influenza, we already talked about that. They're susceptible to that. Highly infectious, and that's by the same transmission routes as it is for people. You sneeze or you touch something, and it's the fomite's got the virus on it. Now that can be picked up by the ferret as well. And it looks a lot like human influenza. Usually the signs are pretty quick after they get exposed. They run a little bit of a temperature. Their temperature is usually up a little higher anyway. And it gets into the epithelial tissue. But any place where there's epithelium, we're going to potentially see this virus. Okay? Sneezing, because it's usually got up in the epithelium of the nose. No vaccine. Okay, usually They talked about giving some kind of vaccine, but nobody does it. A couple of weeks for clinical signs, they usually get better. And then the whole thing is you don't want to not give them something to open up their airways, because a ferret's kind of like a cat. If they can't smell, you're not going to eat, okay? And ferrets really rely on their nose. So if they can't smell the food, their appetite's going to go down. One thing you can use for that is a decongestant, okay? Something to kind of spray up their nose to open things up, okay? And then again, we can cause disease in ferrets if we have the flu. Okay. Aleutian's disease, because these are mustelids, like minks, they can get Aleutian mink disease, okay? Aleutian disease is a parvovirus, just like panleukopenia in cats is a parvovirus and parvovirus in dogs. It's a very long-lasting virus out in the environment. It's difficult to get rid of. When they get this, it looks very similar, okay? They get kind of a wasting disease, fever goes up and down, and then eventually they're going to die, okay? Usually with Aleutian disease. And if you do a blood test, you can find that. Okay, not much else there. Bacterial diseases in ferrets are pretty common. Helicobacter, you guys know what Helicobacter is in people? Helicobacter pylori. It causes GI ulcers, okay? That's one of the things that bacteria will cause. It can do the same thing in ferrets. They are also susceptible to Clostridial bacterial diseases. Botulism is caused by a Clostridium and an anaerobic bacteria. Have you had that in half death? Not yet? Okay. This should be coming. And then there are a few others. Staph aureus. Where do we find Staph aureus? Everybody here is infected with it. It's on your skin. But if that bacteria or any of the others get into a place where it's not supposed to be, it can cause an infection. Okay? So the Staph aureus on our skin is not a big problem. But if Staph aureus gets underneath our skin in the subcutaneous tissues, now it's a problem. Okay? Proliferative bowel disease is another disease that's caused by a bacteria. It used to be called Campylobacter, but bacteriologists have to do something, so they change the names once in a while. Signs are pretty much the same. What happens inside the bowel is the tissues start to get abnormal, they start to proliferate. When that happens, they can't absorb nutrients across the intestinal wall anymore. And when that happens, they start to have this diarrhea, okay? Because it's got to go someplace, they're not absorbing it. Mucus and blood. Blood is going to be frank blood because usually the rectum or the distal colon is the source of blood. And if blood doesn't go through the intestinal tract, like from small intestines down to the colon, it can't turn black. If it comes from high in the GI tract, that's when blood turns black, it becomes tarry, and that's what they call melena. But in this case, it's usually frank blood. Chloramphenicol is a drug that can be used for that, but if you use chloramphenicol, you have to wear gloves because humans are very susceptible or potentially susceptible to chloramphenicol, and it can cause aplastic anemia in people, and that can be lethal. Okay? Yeah, they can die despite what you do, because once that bowel gets changed, it may not reconvert. Gastritis, oftentimes they get it because they're really curious and get into things that they shouldn't get into, and that can lead to gastritis. But one thing they say is that it's stress-induced. Well, most of the ferrets you guys see are not going to be stressed out, especially if they're in a house ferret. But if something changes in their environment, that can stress them out. Helicobacter, again, is the one that causes gastritis and ulcers, so that can happen the same in ferrets. then if they have gastric ulcer, anybody here had an ulcer before? Anybody know anybody that's had a GI ulcer, stomach ulcer? They hurt. And when they hurt, animals usually grind their teeth, okay? We just kind of curl up and act like we're gonna die. But animals oftentimes, when they get GI upset, especially stomach, you can hear their teeth grinding together. Botulism, again, most mammals are going to be very susceptible to botulism. This is a clostridial organism that's an anaerobic bacteria, and it's out in the environment, okay? You can get botulism pretty much anywhere. Usually what happens with botulism is they just start getting really sick, and your muscles start acting funny. You guys have all seen that, right? You know what Botox is? People inject it in their face. Why? I have no idea. Why would you inject something so toxic into your face? People are stupid. Okay? But that's what can happen. It's going to affect muscles the same way. Okay? Death is pretty much a sure thing if they get it. You can give a toxoid. A toxoid is not a vaccine per se because it isn't an antigen. It's just something that's going to hopefully get them to build up antibodies against the toxin. The toxin doesn't come from, it isn't because of the bacteria, it's because the bacteria produce something. Same thing with tetanus, okay? And again, you can try to vaccinate them if you get it. No successful treatment, that's pretty much like with anything else. TB, tuberculosis is pretty rare. I don't really, in fact, I've never even seen it in a ferret. Tuberculosis is always caused by mycobacteria, okay? You know what else is caused by mycobacteria? People? Leprosy. Leprosy is Mycobacterium leprae. Now this is a different kind of mycobacterium. I'm not sure even what species it is. Parasites, pretty uncommon unless it's coccidia. And coccidia, you guys already heard about. We talked about coccidia. They can get into pretty much any species. If there is an immune suppression, then they can get it. Once they get coccidia, you really don't get rid of it. It's in there. What you try to do is treat it so that it stays subclinical, or treat it until the amount of oocysts that are released drop down to a certain level. Ectoparasites, pretty much the same as these, fleas, mites, or ear mites, and you can get into those as well. Sarcoptes is a mite that causes really bad skin disease. We'll talk more about that when we get to external parasites. And it can get everywhere, and it's really, really itchy. Okay, they just go nuts trying to scratch things. Ivermectin is a drug that's commonly used for that. Organophosphates, you got to be really careful with organophosphates. They're great for what they do, but their margin of safety is pretty low. And organophosphates can also create reactions with other drugs. So be really, really cautious with organophosphates. And you can usually see that on the model. It'll tell you what kind of a chemical it is. Pentocephalides is a flea. You've got fleas in the house. It's not just getting rid of them on the pet, because fleas get off the pet, they lay their eggs out in the environment, they hatch, they crawl around in your rug or wherever. Then when they get to be a flea again, mobile, they'll actually jump onto your pet. And they jump on and off every time they need a blood meal. Ear mites, pretty common in ferrets, but they have to be exposed somehow. You can't get an ear mite from nothing. If there's one ferret that's got ear mites, or a cat or a dog, that can be passed over to the ferret. And then again, you can use ivermectin. You can clean the ears up. Heartworms can get into ferrets, okay? And that means that mosquito bites them. They can get a heartworm inside them. But generally speaking, the infection is really not massive like it can be in a dog, right? You might have 1 or 2 heartworms in there, and that's usually about it. Treating them, yeah, you got to try to treat the same thing, but you have to be careful treating heartworms because treatment for the microfilariae and the adult heartworms is completely different, okay? Diagnostics can be done with x-rays or doing blood tests. Usually, not many worms, 10 worms, I don't think I've ever seen one without that. And then we talked about treatment, very, very careful. Treatment. If they have the heartworm, and if you kill off a heartworm and it floats into the lungs and causes a pulmonary thromboembolism, that can be lethal itself. Let's see, ivermectin, we talked about that. Adult therapy. You can use other types of drugs, but generally speaking, you're going to just stick with the ivermectin type drugs. Caparsolate or capriolate, that has been used in the past, but it's an arsenical type drug. They're very, very toxic. And then you have to check them again to see if they got rid of them. We don't live in a heartworm endemic area, so testing our ferrets for heartworms would be basically spending money for no reason. Okay, dental disease, that can happen in ferrets, and they have to have their teeth cleaned, just like cats do sometimes. We talked about them wanting to eat anything and causing GI problems. Any of the white-type ferrets, you have to be careful. You might have to check them to see if they're deaf. If they're deaf, they're not going to respond to sound. Insulinomas, we've talked about those. We see those more commonly now, especially because they've been castrated or spayed really early. Lymphosarcomas are seen. Again, those are the 3 tumors that I talked about possible for Loki. Could have been lymphosarcoma, it could have been insulinoma, and it could have been adrenal gland tumor. Okay? Adrenal gland disease, middle-aged, older, okay, it could have been an adrenal tumor involved. We don't know for sure. We didn't send it out. Adenomas, adenocarcinomas, if it was an adrenal tumor, it was an adenocarcinoma because there was mets everywhere in the body. Usually what we see with ferrets that have an adrenal tumor is you get usually feminization. Okay, a male will start having characteristics like the female. The female has more characteristics of like she's in heat all the time. They start losing their hair, especially in the perineal region, they start losing their hair there. Too much about that. This is again what we just been talking about. Spayed and neutered really young, so they seem to have more of an increase or an increased incidence of those types of problems. Alopecia, again, they start losing their hair, especially the perineum. If you can get rid of it, that sometimes grow back, but it may not go back for quite a long time. And trying to do those surgery in these, you got to find it, and you got to take out the entire adrenal, which means you got to hold the other adrenal. That's going to be okay. Itching cycles, also pretty much the same. Sex hormones, yeah, you can run that. You can find out if they have an increased estrogen level. That could maybe give you an idea of what kind of a tumor it is. If it is that kind of a tumor, there's a good chance that they're going to become anemic because the estrogens are toxic to bone marrow, just like they are in human female. Hormones, again, can be a test. You can do other kinds of tests, like biochemistries, to see what's going on, but those are not specific. They just give you an idea if that's what's going on. As far as taking the adrenals out, that's pretty much the same for any animal. You guys have seen that in your cats, right? guys all notice where the adrenal glands are in cats. Where's the left one?
Cranial to the left kidney.
But where? Relative to other structures. It's usually by itself. There's nothing else around it. Usually the phrenico-abdominal vein always crosses over the top of it. But the right side adrenal gland is oftentimes right next to, maybe even adhered to the vena cava. So trying to get that out is a real pain in the rear. Okay? Sometimes you actually have to open the vena cava and take the tumor out of the vena cava. That's a problem. How are you going to open the vena cava without it bleeding out? It's kind of tough. And there's ways to do it, even the ferrets is harder because the vena cava is so small. Adrenalectomy, if you can get it out, again, depends on what side it's in. If it's both sides, you can pretty much forget it. And again, I don't know if that was what Loki had because we didn't have it tested. Insulinomas, again, that's inside the pancreas. And by the way, insulin comes from the beta cells in the pancreas. Anybody remember that test question? We talked about that in class 2. The beta cells secrete insulin, and they are all over in the pancreas, not just one location, they're all over in the pancreatic tissue. Okay? They can do the same thing in ferrets, and then that beta cell starts to become cancerous. When that happens, there's excess insulin secreted, and their insulin or their glucose level just plummets. Well, when we did Loki's blood test, what was the first blood test? 59, that's too low. That's way too low. It's not as low as Thor's. Thor's got down to 20.
Yeah.
This was really bad. Yeah. So that's why it could have been, well, we know it was insulinoma in Thor because of that response. But in Loki, it was down to 59, so it could have been. And he didn't respond to glucose as well as Thor did, right? So it makes me kind of lean toward the other sometimes. Hypoglycemia, you guys saw that. You all were witnesses to hypoglycemia in Thor. Okay, so you saw the signs. They don't do much. They lay around. They might even start having seizures when they get really low on glucose. Blood glucose is kind of like cats can be. And so this is where you can see Loki was 59. So was that because he wasn't eating, or was that because he had insulinoma? Could he have had multiple tumors? He may have. The other chemicals, biochemistries are about the same. Treatment is essentially just a prolongation of the condition. If you go in and get it, try to take it out surgically, the thing you got to remember is it's already metastasized. By the time you've diagnosed it, it's already spread. So you might be able to take out one big tumor, but it's going to happen someplace else. Okay? Survival time, if you treat them properly and you give them some of these thiazoxides or other drugs that will increase blood sugar, you have to be really careful, because what's the stimulus for insulin release from the body? For you guys? Huh? It's blood glucose. So if you give them glucose, that's going to stimulate more insulin release. So it's going to go down again. You have to be very, very careful using drugs that will do that. Okay, lymphoma, pretty much like other lymphomas, like cats can get it. Can be really young in these animals, lots of tissues. Anytime you find lymphoid tissues like lymph nodes or the thymus, anything like that can be affected with lymphoma. Very rapid onset, it gets everywhere, and they can look like anything. It could be a GI disorder, it could look like pulmonary disorder. It depends on where the lymph nodes or where these lymphatic cells are. Again, non-specific use. One of the treatments for lymphoma in dogs and cats and people is steroids. You give them prednisone. And you can actually make the signs go away and make it very difficult to diagnose. So that's one of the therapies you could use in a ferret, but it doesn't cure anything, okay? Again, if there are lymphatic cells in the spleen, so the spleen can get affected. So this now, you should be able to start thinking in your mind's eye why lymphoma would have been a possibility for Loki, okay? And again, if you haven't seen the picture yet, make sure you talk to Jessica. All right, chemical tests, we do the same thing, CBC, chemistry, and urine, if we need it. If there's too many lymphocytes, then you start wondering, is this possibility of lymphoma? Because the lymphocyte numbers go up. Treatment protocol, chemotherapies. Most people won't do it because it's kind of pricey and the prognosis is usually not very good. Okay, let's see, what does this picture show us? Oh, that's just showing you what's going on inside the lungs. You can see how those little white areas, that's not normal. And they don't respond. Okay, that's pretty much what we've talked about already. Euthanasia, again, barbiturates. That's usually what we use for euthanasia of almost any species now. If you look at the bottle of Euthisol or euthanasia or whatever the drug is or whatever the manufacturer is, it usually is sodium pentobarbital is the primary agent. Same thing works in cats, in ferrets. CO2 chamber is used, but nobody knows nobody has one of those. That means you put them in a tank and then fill it with CO2, and they essentially asphyxiate. Okay? All right, that's pretty much it. Anybody have any questions? Go ahead.
You know, how do you, so that there's more incidences of tumors in ferrets because they're spayed and neutered so early? Is it a possibility that you can do preventative hormonal therapy for those?
You could try, but we're not smart enough. We're not even smart enough to do that in people.
That's a really good question.
I mean, if you look at people that have hormonal deficiencies, testosterone and or estrogen, it's really difficult to do anything with those because we usually screw it up somewhere. If you start treating women with estrogen, they usually have problems with bone marrow because of bone marrow toxicity. And then you have other problems because of chronic estrogen treatments. Same thing with testosterone in men. The ability to treat it with those drugs requires a really close understanding of how much they're supposed to have. And then in order to find out if they have, you have to be doing blood tests very frequently to find out what level they're at. And that's how many people will do that.
So moral of the story is just wait to spay or neuter them.
Yeah, to me, that's what would be the best thing to do. But you can't do that now because all the places that breed them have to get them spayed by 3 to 4 weeks. I would love to see it go back, but then you have to put up with stinky ferrets, stinkier ferrets. You have to put up with doing a surgery on the anal sacs. And I can guarantee you there's a lot of veterinarians that won't do it because they don't like it. And it's really small. Trying to remove there's Dr. C, he can tell us for sure. How hard is it to take the scent glands out of the ferret?
Pain in the butt, literally.
No pun intended.
They
Okay?
do have the implants though for adrenal disease.
Pardon?
They do have the implants for.
Oh, yeah, they can do implants to hopefully prevent adrenal tumors. I'm not sure what that's called. Remember?
Dyslorelin.
Dyslorelin, yeah, that's it. Those little implants work to some degree, but that's kind of because it's trying to maintain hormonal levels, okay, the adrenal hormone levels. I've not had much experience. How much have you had, Doc?
A lot. It's kind of become the treatment of choice for the adrenal tumor issues or adrenal hyperadrenal corticism issues. But it's kind of become the treatment of choice because surgery, I used to do a lot of surgery and they keep coming back.
Yeah.
And my
It's hard to get margins.
metastasize. Do what?
It's hard to get margins on those little things.
Yeah, and I even, if we want to talk in stories, the right adrenal gland lives right next to the caudal media cava, so it's a real pain to get out if it's a problem. And there for a little while, we were actually doing, I actually did a few of the, it's kind of like an amyloid renal that you cellophane. So
Yeah.
you'd go in there and you dissect out the caudal vena cava, do some sterile cellophane around it, sew them back up, come back about 3 or 4 weeks later, and that would close off the caudal vena cava. And so you could go in there and take that section with the right adrenal gland out. And I did that a couple times and it still came back because it micrometastasized to the liver. So we were like, not worth all that effort anymore.
Right. And it's a carcinoma, so it's going to spread. Usually by the time, like we were talking earlier, by the time you find it, it's already spread. You just can't see it yet. Okay? We see that same thing in other species with carcinoma and sarcoma. Other questions? Okay, now, you got Dr. Cassiopo here. He knows more about this stuff than I do. So in your lab, you got 2 ferrets going out. I had to put Loki to sleep because he had tumors. I'll let Jessica show you the pictures of what I found in his abdomen.